Hello and welcome. This is Jason Atkins with the One Test Prep, and I'm so excited to be here today with my special guest, Khalid Scott. And we are here to talk about social work exam prep. We want to help social workers become better prepared for their license exam. Social workers that are taking your license on your bachelor's, master's, clinical level in the US or in the Canadian provinces, we want to help you by showing you some of the ways to help you get through the material and be better prepared.
So today we're going to talk about the theory about attachment and bonding.
Tell us about kind of just the general framework of the principles of attachment and bonding.
Basically, in clinical social work, we refer to the theorists John Bowlby and Mary Ainsworth and their definition of attachment and bonding, which is basically how you bond with your caregiver. So it would be a child to the parent, to a couple, a husband to the wife to the husband, children to a teacher, just basically bonding and attachment and what the different styles and techniques and forms there are with bonding.
Talk to me more about principles of attachment and bonding. What's the meat of it, right? What was John Bowlby and Mary Ainsworth really wanting to accomplish here?
For me, when I'm teaching students or meeting with people who are preparing for the exam or talking to my professional mentors, I try to break it down where it's kind of like how you look at terminology from a realistic everyday approach to how that DSM-5 teaches you. And remember, the rule of thumb is when you're taking the exam, you tend not to bring your professional experience in, but more so what you have been taught, right? Because remember, what you learn in school is foundational driven. What you do at work is survival of the social work life. You know what I'm saying? So some things we do every day, when we really think about how it should be really done, we could go back to school and the foundation that we learned. And I have kind of, and I'm going to cheat a little bit today because I have it written down because I really want to stay in order because this is so important that you learn, again, the academic way of looking at things, right? So first of all, let's talk about attachment and bonding and why it's so important. Let me use me and my brother Jason as an example. We met through social media, right? And what happens is when we think about social media, we think about it's a coldness because you're not meeting the person in person. You're developing a connection, a rapport, communication through the cell phone or through a laptop or through a computer. So it's a coldness, right? But I've learned with social media, depending on how much you talk and what you talk about with the other person on the other side of the screen, it started building a bond.
Sure.
Now, what you can do is take it to the next level, right? And finally meet. So about a year or two later, me and you finally met. I drove all the way to the north side to meet you at the coffee house. You know what I'm saying? But because we had talked to each other that year or two, it wasn't like we were going in there cold turkey. Right. It was a warmness when we first met each other, right? And then remember, we're social workers. We have been taught to be sociable. And we understand, especially working with students, working with clients, you need to build attachments. You need to have bonds because this is a village.
Certainly.
Right? And so now, take it from that. Let me put on another hat, my clinical hat, and talk about the different types of attachment styles.
Sure.
Secure attachment. So when you think about secure, you think about security, what comes to mind is feeling safe, right? When you don't feel safe, you don't build an attachment. So that's why, like, one of the most popular test questions I remember is a client comes in to meet with you and they tell you about their life journey and all the trauma and drama that they've been through, correct? And the question is, what is the first thing you do as a clinician, right? And the answer, at least back when I took the test, A or B or C or D, validate their feelings.
Sure.
So then someone says, well, why is that important, right? Think about that, folks. When a person knows that I've told you the innermost issues that I've been dealing with, and they're so used to people judging them or looking at them sideways with it. But then you're taking this information in, you're looking at them eyeball to eyeball, and you're saying, you know what, Jason, thank you for being brave enough to share that with me. And I can only imagine how you feel in that moment.
Certainly.
With that, right then and there, is building a bond. It's saying that I'm trustworthy. You can trust me. First session, I'm starting rapport building. I want to build an attachment. You know what I'm saying? Because you're about to pay me to tell me your secrets.
We're talking about secure attachment.
Mm-hmm.
And when I think of again, with the exam preparation that I've provided for tens of thousands of social workers since doing this work since 2012, we give exam vignettes, right, in our study groups and in our modules. And there's one that comes to mind about attachment, where it talks about a family that came in for a therapy session, and the child gets up in the middle of the session and starts talking to the social worker and saying, "Hey, is this over with? Can we leave now? It's time to go," right? And so now we have to look at, as clinicians, what is the level of relationship that the child has with the parents in this scenario? Because the vignette asks, what should the social worker do next or first, right? Next, first, best. These are some of the ways the exam questions are structured.
Right.
But when you're the social worker who's trying to solve that for your exam, be sure to take into account, what are you seeing in the relationship between the parents and this child? Are the parents being reactive to this child? Are these parents being supportive? Are they listening? Are they engaging? Are they meeting this child at the child's level?
Correct.
Are they just meeting them eye to eye and saying, "Hey, I want to understand. Talk to me about how you feel and what's going on"? Or are they, how are they managing that relationship? Because as clinicians, we are constantly assessing throughout the rapport building process.
I've learned as a social worker, it's what's not said that I need to pay attention to. Because anybody can come in with a script or with a mask on and want to portray one thing. Right. But for me, 31 years of doing this, Jason, I can see something out of place 10 miles away because I've studied human behavior. For me as a clinician, holding up the mirror is the easiest part of my job, but the most challenging part of my job, because most people aren't used to looking in that mirror, Jason. And when you look in that mirror, you have to see all the blemishes, the scars, the freckles, the wounds. And I'm giving you the cold cream to say, so let's put it on your face and let's clear it up. So now we're going to go into ambivalent and insecure attachment. So I want you to think about that, social workers. When you hear ambivalent and insecure, that's when your guard is up. And remember, when somebody's guard is up, something led them to build a wall around. Something built that defense mechanism. They've been hurt. They've been damaged. They've been traumatized.
You got to recognize that as an infant, communication is more through action than it is through words.
Yes.
An infant doesn't have the skills or the abilities to articulate, "Hey, my stomach is hurting and I really need to use the restroom right now." So what do? They cry, right? And how those needs are met, how quickly and how effectively their needs are met by their caregiver, helps either build that attachment and that trust, or creates the insecure ambivalence that you're speaking to right now.
Avoiding an insecure attachment. Children tend to avoid the parents, neither reject or seek out contact, and might be a result of abuse and neglectful parents. And then as an adult, you have difficulty with intimacy. So I want to avoid you. And that doesn't work. That's why divorce attorneys are rich now. Disorganized attachment. What comes to your mind when you hear disorganized attachment?
The undertone of disorganized attachment has to have an element of dysfunctional relationships.
Yes.
And dysfunctional, something that was at one point connected has been severed. When you build trust and rapport, this is This is directly about understanding the patient's or your client's attachment style.
Yes.
When you understand how they attach, that helps you understand where they place their trust.
And then I want to touch upon now tailoring interventions, because that's important
Yes.
as clinicians. Basically, when I think about tailoring, I think about this is a polar opposite of the cookie cutter approach. It's like when I was in the military, we all got treated the same in boot camp.
Mhm.
Do your 100 push-ups and be quiet, you know? And a tailored approach is you understand that different people come with different life experiences. And how I treat client A is I have to treat client B, C, D through Z. I have to treat them differently, right? Based on the working knowledge I've developed, my observations, right? And then my clinical experience and wisdom. Like I might have a way of doing things and it might work for 10 other clients.
Sure.
As a rapport building. But this one new client might come in and like, I don't want to talk about religion. I don't want to talk about spirituality.
Mm-hmm.
I'm an atheist. Now I'm not an atheist, but now I say, well, if I'm building rapport and I don't want my client to feel judged, how do I walk in the middle? How do I remain neutral? So I have to tailor my approach to that client. Let me read this. Securely attached, right? And that's clients may thrive in empowerment focused modalities, right? And when you think about empowerment, you want your clients to feel that this is on me. I'm in the power position.
Very practical driven approaches like DBT.
Yes.
Dialectical behavioral therapy is one that is truly about practical approach. The first thing they talk about, Dr. Marsha Linehan talks about in her guide to do it, is skills.
Yes.
And the recognition that skills are learning, trainable things that we can all learn how to do. And then do you recognize the need for the skills and are they useful for you?
Absolutely.
And so DBT is one of those practical ones.
Next, I want to bring up anxiously attached. And then this is teaching coping strategies to manage their anxiety in relationships. So if we're married and I'm fighting with my wife, and I become anxious because, oh my God, I forgot to pick up the dry cleaning, and I know she's going to get on me because I always forget, right? How do I make that better? I come in the house and like, wife, I forgot to pick up your cleaners because I was trying to look for a flower store to buy you some roses. Nice. But I'm going to leave right back out and go and pick up your dry cleaning. Love you. So what you're doing is, I'm not going to keep doing things how I normally, and I got cursed out, and I got yelled at.
Sure.
I'm going to butter up the situation and then go back and make amends for what I didn't do right. And hopefully I'll learn to have better strategies to make sure I don't make this mistake again. Next, avoidably attached. And then that's recognizing and expressing your emotions, right? And that means being honest.
And
being
vulnerable.
Very good. Some clients have an easy, they feel easy about being vulnerable. But then you got those clients who are guarded.
They're like a shell.
Absolutely.
Almost like a clam shell that's unwilling to open, right?
Absolutely. And then for me, in my private practice, and I work for the VA, I work with a lot of male clients. Mm-hmm. So you talking about having guards up and being very stoic, I have to be very creative on my engagement.
There's actually a lot of really good research around using humor.
Yes.
Humor is a really valuable tool in the right conditions.
Absolutely.
To be able to reach those unreachable clients.
Absolutely.
So there are a ton of ways that we can get through the patients who are putting up their guard, and they're putting up their guard for a reason, right?
Absolutely.
And so honoring that reason, but also finding which level we can break through on is a critical piece for you all as clinicians.
Absolutely. And just an example. So say if Jason was my client and he's very stoic, but then he somehow, when I was doing the social assessment, right, he told me he was a former athlete, right? Then I would use that to my advantage because from what I know about athletes, they're passionate about sports. right? It made them feel good about themselves. So maybe I would say something about, wow, when did you retire? When did you retire?
2003.
Wow, you still look like you played professional ball.
Oh man, thank you. I take pride in working out to this day.
So see how he went from stoic to, oh, okay, wow, you got me.
Yeah.
You got to be creative. You absolutely have to be creative, right? And again, that's rapport building. That's good communication, and that's starting to help build trust and attachment with each other. Lastly, disorganized attachment, and that's basically emphasizing safety, understanding the triggers of your client, and then developing grounding techniques like you brought up. You know what I'm saying? And then again, you take the mixed thought patterns and you're saying, let's get rid of all these thoughts you have in your head and let's really get focused. Let's really get focused on what your needs are. What do you want to accomplish? And how can I help you get to that point? The bonding that we're doing right now, we're feeding off each other as we're doing this video, right? Here's what I have to say, and he piggybacks. I'm hearing what he's saying, and I'm piggybacking, right? And again, that's because we have a rapport. We trust one another. We're honest with one another. And this is what you want to work on with your clients. Because the better you build your rapport, the better you build your therapeutic relationship with, the easier your job is as a clinician. Well, that's all I have with this.
So I want to just take this moment to, again, thank you, Khalid Scott.
Absolutely.
You bring to the table a lot of energy and passion for our profession.
Yes.
You are a great representative of, so many different dynamics of what a good clinician can and should be. And I'm grateful to even have built rapport and relationship with a person like yourself, who is a person who is affiliated with so many different organizations. Yes. Because of your collaboration background. So from all of us at the One Test Prep, we thank you all for watching this. And Khalid, again, thank you for joining us today.
Absolutely. All right. Good luck. All right.